Typically, this implantable artificial heart valves are of two types. One type of valve is the metallic valve, which has been traditionally, the metallic valve has been used for several decades with very good results. For younger individuals, we prefer to implant a metallic aortic valve. That's because metallic valves are very durable. They last for 3 decades or even sometimes even more. But in older individuals, we implant what is called tissue valves. Tissue valves are actually made up of some form of living tissue, which are derived from some kind of an animal. And tissue valves are usually reserved for those individuals who are older, who are usually more than 60 or 65 years of age. The chief difference in the metallic aortic valve and the tissue aortic valve is that an individual who gets a metallic aortic valve needs to be on a blood thinning medication for the rest of his life. Otherwise, there's a risk that there can be clot formation on the valve and compromise the function of the valve. So that individual has to be on a lifelong blood thinning medication, which puts the individual at risk of complications of the blood thinning medication. So in older people and frail people, we try to avoid the metallic valve because we don't want them to put them on lifelong blood thinning medication. And because they're older, we don't need such durable valves. So tissue valves are a good alternative for them. And because they can be, the tissue valves become part of the human body once they're implanted in a few weeks' time. And there is no requirement for a lifelong blood thinning medication in these individuals. The transcatheter aortic valve that is implanted without surgery is typically a tissue heart valve. So because it's a tissue heart valve, it is usually reserved for the individuals who are older than 70 years or more.